Hello, my name is Richard Linane and I'm head of the Biological Weapons Convention Implementation Support Unit based here at the United Nations Office for Disarmament Affairs in Geneva. I'm sorry I can't be with you in person today. Unfortunately, we had a number of other commitments, which means that our very small unit is spread over the world and not with you in Vienna. But I am pleased to be able to record this video message to tell you a bit about some of our perspectives and our activities related to, well, building a CVN security culture in the biological field. And I've put the title of my talk to you as the network approach to management of biological risks. This is because there are certainly some features of managing biological security that are shared with the nuclear and chemical fields, but there are also some areas that are some aspects that are quite different. And it's some of these that have really forced us in the Biological Weapons Convention to develop what we call this network approach. And one of the main considerations is that, again, somewhat in contrast to the nuclear and chemical fields, the risks of biological weapons or bioterrorism is really part of a spectrum of interconnected risks, starting with naturally occurring diseases, moving through the possibilities of mistakes or experiments gone wrong, moving through to vandalism, sabotage, and then to biological weapons. This is a bit different to nuclear, where, fortunately, there are no naturally occurring nuclear explosions. But for many governments, of course, they're greatly concerned about naturally occurring diseases, re-emerging diseases, human diseases, animal diseases, plant diseases. These are all important national and international concerns. And really, the risks posed by biological weapons fits in as part of that spectrum of broader biological risks. And so in managing these risks, in dealing with biological security, an important factor is integrating our activities with the activities that are dealing with the naturally occurring risks, with natural disease outbreaks and so on. So a lot of what we do is build networks, build relationships, integrate, coordinate, harmonize with a wide range of actors and activities that are all dealing with different parts of this spectrum of biological risks, as we call it. And an important part of that is that it's something really that, if it was ever possible, it is certainly no longer possible for governments to deal with these risks alone. And I'm going to read you a quote from the Secretary General of the United Nations, Ban Ki-moon, who said at a BWC meeting in 2008, "Governments alone cannot confront the risks posed by biological weapons. To manage the full spectrum of biological risks, you need a cohesive, coordinated network of activities and resources. Such a network will help to ensure that biological science and technology can be safely and securely developed for the benefit of all." So that really sums up the approach we've seen over the past few years in the Biological Weapons Convention. It's about building a network. Now, that's not just a network of governments, it's a network of many different stakeholders. Certainly international intergovernmental organisations are a key part. We deal with the World Health Organization, with the World Organization for Animal Health, with the Food and Agricultural Organization. We deal with Interpol, the International Criminal Police Organization, on bioterrorism aspects. There are a number of other international organisations that are involved, and of course we work very closely with Security Council Resolution 1540, the expert supporting the committee, and so on. But beyond that kind of international intergovernmental level, there are many other actors involved. There's the international scientific community. Biology is developing very, very rapidly, as I'm sure you're aware. Many exciting and extraordinary developments, and capabilities are spreading very fast. There are experiments and research and work being done now in very small laboratories in many places around the world that only 10 years ago could only have been done in most advanced and expensive laboratories in a few developed countries. Those capabilities are spreading. Many more scientists, many people around the world, in developing countries also, have this capability now. This is, of course, very good news. It's good news for science, it's good news for economic and social development, it's good news for medicine, it's good news for agriculture, it's good news for human development. But of course, it carries with it risks, and we're finding that with these very now powerful capabilities in many fields of biology, available to so many more people in so many more facilities in so many places around the world, this is really quite a challenge. And it is not a challenge that governments can deal with themselves, any arm of government. Of course, governments have a role. Legislation, regulations, export controls, standards and licensing, laboratory rules and procedures and so on. But we need, and governments of the states parties to the BWC have recognised this, we need the support of the international scientific community. We need the scientists themselves to, in a sense, self-regulate. They need to build a culture of responsibility. They need to take charge of managing this risk because, very bluntly speaking, it's impossible now for governments to do so. There are too many advanced biological facilities around the world to monitor. We could never, in the biological field, take the approach, I think, of having inspectors to go and check all potentially relevant biological facilities. There are thousands, tens of thousands. It would be impossible, and it's getting more impossible, if you can say that, every day. So the scientific community, that's one of our most important partners in building this network. Another important partner is the emerging community of biosafety professionals. There are a number now of national and regional biosafety associations which have grown up to exchange good practice and build professional kind of resources to improve biosafety practice and procedures around the world. Those national and regional associations have now been complemented by the International Federation of Biosafety Associations. So there's now a genuinely international community of biosafety professionals who are helping to manage some of these risks. The further partner we work with is the commercial industry, the pharmaceutical and biotechnology industries. This is a part of a network we would like to develop much further. It's at quite an early stage, and it's certainly something we would welcome discussing with our colleagues in the chemical and nuclear fields and ways to better engage the commercial industry, how we can get private companies and industry associations more involved in building this network, in helping to reduce risks and to build a CBN security culture. So I'll stop there. I wish you a very productive discussion. Again, I apologise for not being able to be with you personally, but we do want to stay in touch, and we think this is a very interesting area, and we would be most happy to engage in future collaboration on this topic. Thank you.